Hi, welcome. I'm Jennifer Gunn. I'm the director of the Institute for Advanced Study, and I want to thank you all for coming out when the weather is beautiful and in a week that has been for many of us consumed with tension and anxiety. We're either depleted or ready for the solace of intellectual stimulation, or maybe both. Anyway, we're glad you're here. I want to start by reminding us that though we are scattered, most of us are residing on traditional, ancestral, and contemporary lands of Indigenous people. The University of Minnesota is located on Dakota land, ceded in the treaties of 1837 and 1851. The IAS acknowledges that this place has a complex and layered history. This land acknowledgement is one of the ways in which we work to educate the campus and each other about this place and our land and our relationships with it and with each other. The IAS is committed to ongoing efforts to recognize, support, and advocate for American Indian nations and peoples. So we're going to be running a shorter time than usual today. We'll be stopping at 4:30. So I just want to give you our Zoom instructions. The chat is sort of disabled. So type your questions into the Q&A double balloons at the bottom of your screen. You may type them in anytime. And then at the end of Professor Lupton's presentation, I will read her those questions. So today's talk is jointly sponsored by the Institute for Advanced Studies and DASH and our other collaborators in the Human in the Data initiative. I've been wanting to hear Deborah Lupton ever since my friend Elizabeth Toone at the University of Manchester drew my attention to her work. Professor Lupton is a prolific scholar who has written something for almost everyone. I'm also a big fan of her blog, This Sociological Life, but I will now back up and do a sort of proper introduction. Deborah Lupton is Sharp Professor in the Faculty of Arts and Social Sciences at the University of New South Wales, Sydney, working in the Center for Social Research and Health and the Social Policy Research Center, and leading the Vitalities Lab. Her research is interdisciplinary, spanning sociology and media and cultural studies. She's the author or co-author of 17 books, the latest of which are Data Selves, which came out in 2019, the second edition of FAT, Digital Health from 2017, and The Quantified Self in 2016. She has also edited or co-edited a further 8 volumes, including Digital Food Cultures with Zena Feldman, which came out with Routledge this year. Professor Lupton is a leader of the University of New South Wales node of the Australian Research Council Centre for Excellence for Automated Decision Making plus Society. And she is a fellow of the Academy of the Social Sciences in Australia. She holds an honorary Doctor of the Social Science degree awarded by the University of Copenhagen. We are happy to welcome her today to the University of Minnesota. Professor Lupton.
Thank you very much, Jennifer. It's great to be here. I will just share my screen. Okay, so hopefully everyone can see the screen. So thanks very much. It's great to be here, and I totally understand that all the people in America are on tenterhooks, as in fact most of us around the world are, looking at the counts. So I do hope that what I have to say today might distract you for a little while. I have been preparing for this talk by watching Fargo, the television series, so I understand the psyche of people living in your part of the world, I'm sure. And but on the dark side of things, I also understand that COVID actually has been affecting your area very badly recently, which I'm very sorry to hear about. So perhaps this talk might have quite a bit of additional relevance for people living in your part of the US. So as the title suggests, Human COVID Digital is what I'm going to cover today. And I'm just going to begin by providing some context to the specific material I'm going to cover in this talk. So as Jennifer suggested, I do have rather an interdisciplinary approach. I've been researching the sociology of health and illness for a long time, ever since my undergraduate days and into my PhD. I also have a Master of Public Health, so I did do some specific training in public health and learned all about epidemiology and health promotion, health economics, for example. And then I stayed on in a Department of Public Health, which was at the University of Sydney in the Faculty of Medicine there. And that's where I did my PhD, which is actually looking at Australian news coverage of HIV and AIDS, because I did it around the time where HIV/AIDS was a new condition and HIV was a new virus, and we were still grappling with how to deal with the control and containment of the spread of HIV. So I was really interested in how the media kind of presented representations of that new disease and the risk groups. And of course, as we know now, there was a lot of discrimination and marginalisation of risk groups related to HIV. So those were the kinds of issues I was covering in my PhD, and went on to write quite a bit about general aspects of sociology of health and illness and of public health since my career started. And I continue to be interested, which is why I'm very interested in how we're all responding to the COVID crisis. I also started writing about digital aspects of everyday life and social relations back in the 90s, when I started noticing how people were incorporating their personal computers into their everyday lives. And of course, back in the 90s, personal computers were very new technologies for us, and we didn't have mobile devices, we didn't have Wi-Fi, but we were learning how to live with and through and together with our personal computers, and they were having a big impact for some of us, particularly in academia, on how we conducted our everyday work and our research, and just basically use them as glorified word processors in some situations. But we're also learning how to use email, for example, so we were learning how to connect with others using digital devices. So I was writing about that back in the 90s as well, and continue to do so. I've been more recently interested in the sociology of futures, how we understand people's imaginaries about the future, and how we can use different social theories and research methods to understand those imaginaries. I've become interested in design and arts-based sociology, so how to use innovative, creative research methods for understanding people's everyday understandings and practices and attitudes and social relationships and ideas of selfhood. I'm also interested in smart technologies and the Internet of Things. I've written quite a bit about those technologies as they emerge over the past few years. I'm interested in the digitisation and datafication of humans, which is part of our engagements with smart technologies. And I'm also interested in the digital data economy and data valence, or the watching of people using their data. And all of those perspectives and theories and approaches really do come together in interesting ways when we think about how humans are being digitised and datafied in the context of COVID-19. As Jennifer mentioned, I published a book called The Quantified Self a few years ago, and the subtitle of the book was A Sociology of Self-Tracking, because I didn't want to suggest that it was, you know, the entire kind of world's approach to sociology of self-tracking. It was my perspective on how sociology could be used to understand this, what was at the time quite a new idea about quantifying the self, and the quantified self movement was receiving a lot of media attention in the early 2010s, and I was quite fascinated by that and interested in the way that we might understand the desire for people to quantify themselves, to measure and monitor aspects of their bodies and their practices and preferences using digital technologies, because it really was becoming quite a well-known phenomenon a few years ago, and seems to be expanding into lots of different domains of life, into education, into academia for that matter, into health, of course, and to many other domains of everyday life. So this book really was a theoretical analysis, mostly from a Foucauldian perspective, on how we might understand this moment of quantifying the self. And the Data Cells book is my most recent authored book. It came out last year. And what I tried to do in that book was incorporated some of my empirical research on people's self-datafication, self-tracking, and how they generated data about themselves, how they interpreted those data, and how they used those data to make changes in their lives. But also in this book, it sort of marked a bit of a change from Foucauldian theory into new materialism theory. And I'll have a bit more to say about that because I really want to focus on that kind of materialist perspective in this talk. So just to get back to COVID, and again, I'm providing a context for the talk. I've been, as someone who has been trained in public health, but also in sociology and anthropology and media studies, I've been quite fascinated by the complexities of this new disease, this new coronavirus, the novel coronavirus, SARS-CoV-2. And you know, it's a disease and a virus that a year ago we had not heard of. It hadn't been identified. And throughout this year, we're learning more and more about the virus. We're learning more and more about how to contain and control it, often through trial and error. And many countries have approached the control of the virus in rather an erroneous way to the point that it hasn't been well contained. It's interesting to reflect on the difference, for example, between how my country, Australia, has controlled it actually quite well, compared to how the US, for example, has controlled it. And that gets back, in many cases, to the extent to which politicians and health authorities listen to expert advice and acknowledge the realities of the way that the coronavirus spreads. So I've put together, and I still work on this because every time I think of something new, I put it in, but I've put together this little table which tries to look at all the moving parts of the coronavirus pandemic and all the different aspects really that need to be considered when we think about how the virus can be contained and controlled. So it ranges across from the social and cultural and political and economic dimensions of the pandemic to very specific practices of individuals, personal hygiene practices, to the spatial elements, all those different aspects which contribute to either facilitating the spread of the coronavirus or controlling the spread of the coronavirus. Aspects around testing, tracing, and data around coronavirus, which are very important, of course, because we need to be up to date on how the virus is spreading so that we know how we ourselves should behave in response to it. And as you note there in that column, I have included digitised surveillance systems, which I'll talk a bit more about in a moment, and the role of digital or automation in contact tracing, for example. And then there's all the medical dimensions. Now, of course, these are not in separate, even though this little table looks like they're in separate categories. Of course, they all interrelate with and to each other in very, very complex ways. So looking more specifically at digitised COVID, since the emergence of the pandemic early this year, and that spread across the world from February, March this year, a whole range of digital technologies and devices have been generated and brought into play by different countries, different jurisdictions, in the attempt to learn more about COVID, the attempt to inform the public, and the attempt to facilitate self-isolation, physical distancing and quarantine measures. So we have the basic COVID information apps and websites, which just give us the information about COVID. The World Health Organization has a very important and knowledgeable website where it gives up-to-date information about COVID around the world, for example. Then, of course, we have online news, and that's been good and bad in terms of the accuracy and what's been referred to as the infodemic of poor information about news about COVID, but also it has been some aspects of the online news media have been very, very influential and accurate in terms of spreading appropriate information about COVID. Then we have contact tracing apps, and I've got a photograph on the left there of the slide, which shows the Australian COVID Safe app, which has been quite controversial because it was rolled out early in our lockdown period, which began from mid-March into late March nationally in Australia. And this app was promoted by our government as a way for us all to, you know, learn to live with COVID, to protect ourselves from COVID, and as a way of coming out of lockdown. But in fact, it's had very little effect. It doesn't actually work very well on iPhones, and it hasn't been used very often for contact tracing. So it's a bit of a fizzer. And I'm also aware that there's lots of other different countries that have different kinds of contact tracing apps, some of which have worked better than others. We have symptom checking apps these days. We have wearables and scanners and drones that can actually check for people's temperature, for example. We have quarantine surveillance apps and wearables and drones and robots, as well as facial recognition technologies, which have been used in some countries, not in Australia, but in other countries, to actually check whether people are actually staying in quarantine when they've been required to stay in quarantine. We have QR codes and scanners, which people can use when they go into public places and which can be used for contact tracing if there's an outbreak. We have video conferencing platforms and apps, of course, like the one we're using right now, which have become a central feature of our work in academia and many other professional work environments. We have education platforms and apps that learners have been using at different levels of the education system to learn from home. We have telehealth services, and I know in Australia, I'm not sure what the situation is in the US, but I know in Australia, telehealth services have been implemented very well and have had a remarkable take-up over the COVID lockdown in particular, where people couldn't easily go and see their GPs or were worried about going to a general practice because they were concerned about contracting COVID there. And then we have dashboards. We have dashboards often in quite real time in terms of updating COVID cases or death statistics. So there's very many ways in which COVID has become a digital phenomenon. And if we look at how human bodies have become digitized, then there are these dimensions. So there's a photograph there that's taken from a Chinese app that's used to ensure that people who have been identified as exposed to COVID infection because they're part of a network where someone has been infected, this is the app that they are required to use, which actually does prevent them from going out if they receive a warning, basically a red traffic light warning that they're not allowed to go out to public places. So there's those kinds of apps that do in fact have a material effect on the movement of people's bodies from place to place. There are geolocation apps, again in China, and perhaps some other countries. There's apps where people have been advised or required to stay at home, and they have to upload a selfie periodically to prove that they are in their homes. So that's actually a photograph, of course, of themselves that they are required to digitize and send to the authorities. There's apps that document people's infection status and therefore give them permission or not to move around in public places. There's the apps that I've just talked about in China, for example, where someone's contagion risk is algorithmically calculated to prevent them from going out if they're in the red traffic light warning level of contagion risk. There's apps that monitor contacts with other people, and that's in fact what the Australian COVID Safe app does. It uses Bluetooth technology, and it is anonymous, but if somebody who's been documented as being near you in a public place becomes infected with COVID and lets the authorities know, then you are notified through the app. There's digital technologies that look at people's mask wearing status using facial recognition, for example, with drones or robots, for example. And then, of course, there's many ways using digital technologies that people's biometrics are monitored and measured and algorithmically processed in some cases to determine whether they might have COVID. So there's body temperature, There's new apps looking at what's called vocal fingerprint of people, and that is where people actually record their voices, and it could be actually doing a cough. And the app is touted as processing that sound data and determining whether that person sounds as if they might have COVID-19. And also apps looking at breathing rate and heart rate as well. Now, in terms of the theoretical perspective that I have when thinking about the human COVID digital assemblage, these are the kind of dimensions that I see as coming together in assemblages, and I have created this Venn diagram to show that, of course, all these phenomena or agents are interrelated. So we have the virus itself, which is a very powerful agent, as we have discovered, with its own vibrancies and vitalities, and its effects on human bodies, and human bodies' effects on other human bodies, whether or not they're contagious with the virus. There's other living things that are part of these assemblages and these entanglements. And when we think about what the origin of the coronavirus is believed to be, of course, that's where non-human animals come into play, bats, for example, and their role in transmitting the coronavirus from the bat population into human bodies, and therefore from human bodies into other human bodies. But we also have the broader issues around the environment and concerns about how the ways that humans have had impacts on the ecosystem and on other animals that has generated the kind of novel pandemic that we are seeing, and which has had such a big effect on human lives this year. Then there's COVID restrictions and precautions, which are all about how human bodies should be managed and where they can go and when they can't go, and what behaviours they should engage in, which they shouldn't, what things they should touch, what things they shouldn't touch, what things they should wear, such as face masks. Then, of course, we have digital devices and data, as just discussed. We have other non-living things and spaces. So it's interesting to think about how the space of the home, for example, has become represented as a particularly safe space where people should keep themselves safe, protecting themselves from other people, and particularly from strangers in public places by staying at home. But it's interesting that there's been some newer discourses which have talked about the home as a space of contagion, and that's happened in Australia, where health authorities have explained that, in fact, you might be more at risk if someone has brought the virus into your home space. You might be more at risk because you're less likely to protect yourself from someone that you're used to living with, for example. You don't feel at risk from them, so you don't wear a face mask around them, you don't keep a physical distance from them. Then there's the affective and sensory intensities that we experience when we come together with all these other dimensions of the human COVID digital assemblages. And I think they're really important to understand and to document in social research and to think about, because they really are a key element of how we respond to the pandemic, and how we might take protective action or not, or how we might actually protest against protective action, as we have seen among some activists in the United States, for example, who dislike the idea of wearing face masks. So since writing the Data Selves book, I've been reading more and more new work that has been coming out. And I just want to talk a little bit about some of the new work that it's sort of fitting into the way that I'm thinking about the human COVID data assemblage. Jane Bennett, who is an American political scientist, is someone who has really influenced my thinking when thinking about the more than human dimensions of digital technologies and digital data. She herself doesn't really talk much about digital technologies or data, but she talks more about the environment. But what I try and do is build on Jane Bennett's work, as well as other feminist new materialists, including Rosie Braidotti, Donna Haraway, and Karen Barad, when thinking through the ways that we might think about the digital data assemblage and the way that human bodies come together with data. So Jane Bennett's latest book, which just came out this year, is called Influx and Efflux. And some of the ways that she talks about influx and efflux, I think has a lot to think about in terms of how we think about more than human assemblages. So this is a quote: influx and efflux, she just explains what she means, invokes that ubiquitous tendency for outsides to come in, muddy the waters, and exit to partake in new, lively, deathly ways of encounter. Now, she wrote this book before COVID, but I think there's a lot of resonance there for how we think about how we're thinking about and learning to live with and through COVID. Another quote: a swarm of non-humans are at work inside and as us. We are powered by a host of inner aliens, including ingested plants, animals, pharmaceuticals, and the microbiomes upon which thinking itself relies. Again, she's not referring to COVID, but we can think how COVID can fit very well in that way of thinking. And a key question: how to bespeak an I alive in a world of vibrant matter? And that, for me, is the crux of a lot of the thinking and researching that I am doing right now, whether it's relation to COVID or any other phenomenon. Having said that, feminist new materialists and other new materialists have been criticised for not recognising and incorporating the thinking of Indigenous and First Nation cosmologies. And people who have expounded Indigenous and First Nation cosmologies have rightly pointed out that those cosmologies have been around for millennia, literally millennia, and have been ignored in a lot of white global north thinking about human and more than human assemblages. And this is another recent publication which I highly recommend from what's called the Creatures Collective, which is a group of people from Australia, North America, Malaysian Borneo, and the Philippines. And they have I guess what's called what they would call a manifesto. And I think it's very, very important that we recognise as people, as white people in particular, like myself, that Indigenous and First Nations, and in fact, going back to historic pre-modern ideas about the body, can really build on our understandings of more than human assemblages. And I'll just read out this part of their manifesto because I think it really is important to think about. So they say, more than just animals and plants, the creatures with whom we engage come in multiple, indeed plural forms. No doubt some look a lot like the other than human beings who regularly appear in discussions of extinction and ecological crisis, but others come in the form of spirits, energies, places, dreams, and most importantly in the entanglements that make it impossible to say definitively where one creature ends and another begins. Still others are the problems, questions, dilemmas, moments of joy, silences, inspirations, and ineffables we encounter and co-create in our collaborations with one another and with our respective communities. And of course, we too are creatures who, in forming this collective, aim to be more conscious of and accountable to the relations that create us and implicate us in the co-creation of the worlds we inhabit. Now, the Creatures Collective is a collective of Indigenous and non-Indigenous people, and I have really been trying to put a lot of work into understanding and incorporating Indigenous perspectives such as these into my own thinking, because I recognise the value of what they have to say about more than human worlds. Now, as you can see from this quote, again, the writers in the Creatures Collective and in other Indigenous and First Nations writing and scholarship, again, tend to focus on the environment and issues of climate change and ecological crisis. So again, what I want to do in my thinking is think about how can I apply these perspectives to thinking about our encounters with digital technologies and digital data. So questions for me are, what can these ontoethico-epistemologies, drawing on a term from Karen Barad, teach us about data? So principally, the idea that digital data are more than human phenomena, and they are implicated in and generative of affective, embodied, and multisensory dimensions. So key words for me when thinking are these. So this idea of lively data is something I've been writing about and talking about for a few years now. It certainly did appear in the Quantified Self book and also in the Data Selves book, but also in other publications, articles and book chapters that I've written over the past few years. And I like this idea of lively data because it does recognise the more than human dimensions of data. And the fact that data are always moving, they're always changing. And when we think about COVID statistics and even the US election counts, constantly changing and moving into new assemblages, data assemblages. The idea of the sensory, how we engage with our data in sensory ways. The idea that data are constantly growing, and which gets back to this notion of lively data, but also understanding data from a sort of more organic perspective as opposed to a highly technological perspective. The idea that we make our data, that we are implicated within the making of our own personal data. That data are part of knowing ourselves, knowing our worlds. That data can be transforming. Particularly if we learn from our data, we can then move on and transform ourselves in some ways, which is what many of the people who engage in self-tracking talk about when they talk about why they actually engage in self-tracking. That's all about better knowledge of the self, which can then lead to better control of one's life, or improving a problem, becoming a better person, basically, is a term that people often use when talking about why they engage in self-tracking. Articulating is a word that I like because it does recognise that you're bringing together digitised information from different sources, from different temporal worlds, that you're bringing them together in certain ways and trying to make sense of them in that way. And the notion of incorporating, how do we incorporate our digital data into our everyday lives? So another two key questions that I like to think about in my work: how do humans make and remake their personal digital data? But how do these digital data make and remake humans? So it's a mutual entanglement. It's a co-evolution, drawing on Donna Haraway's work of companion species, for example. Again, she doesn't really use companion species in relation to data, but I've tried to use that concept, that we are living with and through and co-evolving with and through our digital data. And another idea that I tried to think about and talk about in the Data Selves book was this idea of human data as human remains. And I think if we understand our digital data about ourselves, about our bodies, but also about other aspects of ourselves and our lives and our social relationships, then that immediately makes us start to think about our data in a more than human way, but also perhaps in a more caring way, in a more ethical way. And that's an argument I do try and put forth in the Data Selves book. So it does rest on the idea that our digital data are parts of human bodies and selves, that they are unique to the individual. They are always about ourselves, and they're about our changing selves as well, as we change through time and space. They do require articulation on the part of the individual when making sense of their data. Their meaning is based on context. So whenever we interpret and make sense of our data, we are doing so based on our knowledge of ourselves from previous times. And I've certainly found that out in my empirical research with people talking to them about their data, that people do talk about how they build on their pre-existing knowledge to make sense of what their data are currently telling them. And that, of course, changes in the future as their data change. So these data are open to reassembling, and they're open to recontextualizing. And one aspect I talk about in the Data Selves book, which is why I have this photograph here of skeletons and bones neatly stacked in a reliquary, is that I used a very interesting historian's work, Elizabeth Hallam, in the book. And Elizabeth Hallam talks about the history of the profession of skeletopia, which is basically making skeletons, which emerged in response to the emergence of scientific medicine in Britain and Europe, and the need to use human skeletons to teach human anatomy to the growing medical profession that was learning about scientific medicine. And she talks about the way that, in fact, of course, many graves were robbed to find these very valued skeletons by the skeleton makers, and about how often they had to bring together lots of different parts of different people's bodies in making the skeletons. So it's all about reassembling the bones, articulating the bones into a full skeleton. But also she talks about how the skeletons had different meanings in different contexts. So if you had a skeleton in a medical school, it was used as a form of training and learning about the human body, which then became a different meaning if a skeleton was in a church and seen as a holy relic, or if a skeleton was in a museum in later times and then had a different meaning to the viewers who were viewing the skeleton in the museum. So what I try to do in the Data Selves book is think about those issues and again apply that thinking to how we might think about our personal data and how we reassemble our data, how we make meaning, and how our data changes in terms of the context that it's viewed in. So where to now? The key question that I've been working up to, where to now for critical data studies in this pandemic age? Well, data have continuing power. They have continuing resonance in this pandemic age. And we need to constantly consider the more than human dimensions of data, but also the more than digital dimensions of data. So how we live with and through our data, bring in the more than human dimensions, how other humans, how other living things, how other non-living things that aren't digital come into play when we generate and understand our data. Imagining new data futures and how we can use data for human flourishing are really, really important for critical data studies, more so than ever. How we can care for and about our data and how we can use data for care, for caring for others, not just ourselves. How we can decolonise data. We have some really interesting Indigenous scholars in Australia who call for data justice, for the decolonising of data, point out that there has been ways in which data about Indigenous peoples in Australia have been used as a way of controlling them, as a form of racism, and about how it's really important for Indigenous people to take control over their data and to generate the kinds of data they want to see and that they need to see to agitate for social change and for social justice. So that gets to the point of data justice and how marginalised groups can use data to agitate for change. And it also does get to the point of the data poor or data invisibility and the extent to which if just giving an example from COVID, if there are parts of the world or regions in different countries where certain social groups or certain populations where not enough is known about the infection rates, the death rates of COVID, then that of course means there's fewer services, there's fewer measures for containment, which has material effects on people's lives. And we know from research that there are parts of the world where there are these problems already. So that gets back to the idea that datafication of people can be used in very controlling and constraining and exploitative ways, but it also is incredibly important for promoting social justice and for health-related promotion measures in relation to COVID, for example. So finally, I'd just like to leave my talk with these thoughts, how we might think about data futures and publics. And these are the questions that I'm currently thinking about in my work. How are diverse publics engaging with digital technologies and data? I'm doing a lot of research at the moment on this question. What are the contexts of these engagements? So all these different dimensions of people's social worlds and social identities. What do publics want from future developments? I think that's really important to think about in terms of digitisation and datafication. What concerns do they have? I don't think we still don't know enough about to what extent people are concerned about where their digital data go, what third parties do with their data, how they might be exploited or manipulated by their data. And we don't really give people a voice in promoting or putting forward solutions for any problems they might have. So that gets to the question of how we can give publics a voice in these discussions and developments. So I will leave it there with my talk, and I'll be really interested to hear your comments and questions. Thank you.
Thank you so much. And you can type your questions in the Q&A spot and at the bottom of your screen. And I want to start actually while people are typing. I want to look at this question of the self data and the personal uses of data, and the ways in which data is also being used to kind of create a population, so to speak, or a population picture, and how that relates also to the question of data as sort of proxies. So, you know, when we think about the the coronavirus, it is a virus, but data is often a proxy for something else. And I wondered if you could talk a little bit more about that intersection of the self level and the more populational sort of level.
Yes, well, I guess any form of data, whether it's digital or otherwise, as I guess you were gesturing to, Jennifer, is only ever a partial way of documenting a phenomenon. And people who have done work on the history of statistics and quantification, Ian Hacking's work, for example, and of course Foucault himself did write about these dimensions of governmentality of populations and the ways that measuring individuals led to creating certain norms against which population-based norms against which individuals could then be measured to see if they accorded with the norm or were outlying the norm and therefore were subject to ever greater, I guess, regulation and monitoring. But in some ways also what's important about that as well is the way that normalization and the use of data to create these population norms also then fed in, and of course Foucault writes a lot about this in his work on governmentality and the care of the self, to encourage people to engage in self-care and self-responsibility for the management of their bodies. So I think there's a really intriguing relationship there between individual behaviour and comparison against norms. And as you say, these norms are only ever partial, and they often can be very, very simplifying, simplistic. So that's why I guess I really want to emphasize the more than human and the more than digital when we're talking about digital data. Because one thing I have learned from actually talking to people about their experiences rather than just theorizing about it is that it's such the ways that people decide to generate data about themselves through self-tracking, for example, or the ways that they might compare themselves to digitized norms of populations that have been generated by other people, it's just so highly contextual. It's based on things like their biography, their own history, their knowledge, their prior knowledge of themselves. And people do often engage in that assessment about whether these data are too partial, too simplistic, too reductionist. They do actually engage in that kind of sense making. We're talking to people who engaged in tracking their cycling trips. People talked about the weather, and how the weather could influence how fast they rode that day, if they had a tailwind or they were fighting against the wind. People talked about how other animals, getting in their way, dogs running across the path, or how other traffic, how other cyclists, how, there might be debris on the path. I mean, all those dimensions of the living and non-living world, whether they have an injury, whether they had a late night or drank too much. I mean, there's so many rich contexts in terms of how people make sense of data. And I guess that's where I'd really like to emphasize. Let's spend a lot more time looking at those contexts.
Thank you. And I'm going to go to the questions, which are piling up here. I'm wondering if you can speak at all to who is funding the COVID-related technologies. I realize this may vary from country to country and technology to technology, but I'm wondering how profit might intersect with the development and use of such technologies, as well as the broader social cultural context in which these technologies are deployed.
Yes, that's a good question. So it really does vary, as as the question asker suggests. I mean, I know that Google and Apple are working together to and have, I think they have released a contact tracing app. So of course the huge internet empires are working on contact tracing for COVID. In the situation of Australia, it was a government produced app. In China, it was part of the WhatsApp, I think, Alipay, a corporation, very, very powerful and, you know, profitable organization. So, and there's other countries where you've got corporations working together with governments. So it is very, very complex. It really does depend on the country that you're talking about, or even the region of the country you're talking about, or even a state in a country you're talking about. In Australia, for example, we do have a national contact tracing app, but we have different health authorities in different states that make different rules about, for example, border closures and other public health measures. So, and I know how much in the US, the states are different in the way that they control and regulate COVID. And then there's not really a national response, is there, as far as I know. So it's very, very diverse, actually, yeah, in terms of the digital apps and other technologies. One thing I would mention is Singapore. When I talked about a robot, I was quite fascinated by this. I don't know if anyone's heard about that. So they had a robot dog, so-called dog, that patrolled public spaces like public parks, basically with a little message saying, keep distant, keep distant. So there you go. That was one of Singapore's measures. That was a government initiative.
Okay, that's pretty wild. Shades of Doctor Who.
Oh, well, Black Mirror too, actually. I just thought of I don't know if you've seen the episode in Black Mirror, which involved the killer robot dogs, but it was pretty terrifying.
I was just going to say, it sounds too scary for me. So we have a couple more questions. Someone says, thank you for your talk. It seems that your analysis will focus on cases from different countries. And from the final slide, you also mentioned civic engagement about data collection. Could you kindly share more about your plan on how to do a cross-cultural analysis of civic engagement or data technologies being adopted in very different political and cultural settings?
Yes, that's a big question. It's got a lot in it. I would start by really advocating for a project that's not mine, but which I did talk about in the Data Selves book, called Our Data Bodies. And it's a fabulous project which does have a whole method, and it was conducted in the US, actually, although I think some of the people who have conducted it are also based in the UK. But it was a US-based project, and I really recommend it because it actually outlines the people who ran the project outline the methods for how to engage in, I guess, what might be called in the old days consciousness raising with diverse publics, including marginalized groups. In fact, that's what they were focusing on. So, you know, racial minorities and underprivileged people. They were really trying to work with groups such as those in a group context to get them to talk about their, you know, where their data go, what they understand by their personal data and third-party use, and so on. So I really, that for me is a really great project. what I try to do in my own work, what I'm trying to do at the moment is using creative methods. So I like using things like mapping. Hand-drawn maps is an approach I'm using at the moment with people, mapping the digital technologies in their home and also the data that are generated through those technologies, and then using those as a prompt to talk about people. So once they've made the hand-drawn map, we talk to them and you know, tell us about your map and what you've done there. I've also used creative writing prompts. I've experimented with them in workshops, and I'm about to roll them out in online workshops because of course we can't really do it face to face yet, even in Australia. Getting people again from, I mean, I always try and get people from diverse social groups anyway, because as a sociologist, that's really important to me that I do acknowledge diversity and do try and incorporate. And it's in Australia, it's also often people living outside the cities don't often get included in social research, but that's where the beauty of online technologies can be, actually, because we're obviously a very large country with a very small population dispersed around, basically around the green edges of the continent. And using online technologies for things like interviews or focus groups or doing arts-based method workshops means that I can include people from rural and remote regions in ways that I really couldn't have done before if I've had to travel thousands of kilometres to get to them and so on. So that actually is where online technologies have been fantastic. So we're just about to start those actually, and it'd be really great. So we've got creative writing prompts, for example, getting people to imagine otherwise using creative writing prompts. Because I think another thing that I've found in my research, if you just ask a direct question to people like, are you worried about your personal data privacy? Well, I mean, most people just say, yes, I am, because it's kind of the socially accepted thing to say is, yes, I hate Facebook, I hate Google, I hate Amazon, and they're exploiting us and so on. But actually, when you dig down deeper into that, people, well, at least in Australia, people aren't that worried. They haven't been personally affected by, they don't feel exploited. Can't think of an example where they've actually been exploited beyond seeing a really bad, targeted ad on Facebook that didn't speak to them at all. They, oh, here's Facebook again with these bad ads. So I just give one quick example. So one prompt is drawing on the idea of Marie Kondo. I don't know if people, she had that very popular Netflix series that I know was popular. I think it was based in the US. So the idea from Marie Kondo is, what sparks joy? And I actually use that as a creative writing prompt. So I say, imagine, it's called Data Kondo. And I say, think about all the personal data you have on your devices, images, videos, as well as, text messages, emails, and everything else. If you had to get rid of them because your storage is running out, how would you use the idea of what sparks joy? Which of those personal data would spark joy for you and which don't, and which would you be happy to get rid of or give away or sell or anything? So I think using those kind of methods really gets at those effective dimensions that I'm really interested in.
Well, and I think it gets people thinking about the futures and, the ways in which kind of like off-label drug use, apps can be recontextualized and repurposed in ways that they might not otherwise even see the data as connected. So that's really interesting. Okay, we have one more question and 4 more minutes. I'm curious about some of the surveillance techniques around COVID, particularly as they relate to some of the concerns you've raised. It's one thing for an app to tell me it's not safe for me to go out. It's another for my phone then to be tracked if I do go out with possible consequences. And I wondered if you could comment on this.
Yeah, well, that definitely is an issue. And in some countries, that's exactly what some of these apps are doing. Not in Australia, and I'm not sure exactly what's going on in the US. To be honest, I'm not sure if you do have contact tracing apps apart from the Apple and Google one. But I do know there are some countries, and they tend to be located in East Asia, where there is very targeted and very specific tracking of people. And there's some wearable devices that basically people have to wear if they're in quarantine or self-isolation that will immediately alert authorities if they've gone outside their homes. So that kind of very specific targeting is definitely happening in some countries. In some countries, there are notifications to the point that a person's name might not be mentioned, but it's kind of, people are told who live nearby that this person went to these locations, and you know, if you went to those locations, you need to be very careful. So they probably could be quite easily identified that way. So yeah, definitely there's a very, I think with COVID in general, anyway, with attempts to control and contain COVID, it's that constant public health issue and difficulty of how to manage personal freedom and autonomy with needing to keep the public safe. So some countries have erred on the side of over surveillance because they're desperate to control the spread of COVID, and other countries have completely not even worried about it, don't even have an app, don't do it at all yet, and they actually are seeing very bad consequences health-wise. So yes, it is a very fine tension, absolutely, and something that needs to be considered by health authorities, definitely, when they introduce these kinds of apps.
So we have 2 minutes, and people are saying thank you, but I'll ask you one more question in connection with that. So how are these apps? I mean, obviously mask wearing has not taken, shall we say, in the US on a regular basis. How are these apps being introduced and communicated and enforced in other countries?
Well, it again depends on the country. In my own country, Australia, basically our Prime Minister led the charge and said, here, the government's developed this app. I'd like every Australian to use it because it's all part of you know, controlling COVID and getting out of lockdown. He actually presented it as a way for us all to get out of lockdown when we had our national lockdown earlier this year. And I think about 7 million of us, and there's 25 million of us in Australia, did quite quickly download it. But then there was a lot of controversy in the media about the fact it actually was pretty bad, and not in terms of privacy at all. It doesn't have privacy problems. It just doesn't work very well for contact tracing. So yeah, again, it depends on the country. In our case, it was from the very top. It was our Prime Minister who advocated for it and pushed it. But in other countries, it is at a more very, like I know in China, for example, there's more regional health authorities, which because they have a history of very targeted regional health authorities and government officials who keep a very close eye on people's health-related behaviours and reproductive behaviours in the past, for example. So they have a tradition of you know, that surveillance anyway, that they could then just quickly build on. So again, you know, you have to look at the history in some ways of public health measures in a country, and that will inform how a contact tracing app's been developed and implemented.
Well, you know, in that issue of contextualizing and then recontextualizing, it is interesting to think how these are being introduced and discussed, and how that affects reception, where reception is voluntary. So, well, thank you so much. We really appreciate you doing this at the crack of dawn in Australia, and I hope we'll come back again. And remember, people, you can sign up for This Sociological Life if you want to follow Deborah Lupton's blog. And I can't thank you enough for coming at this very peculiar time in our data counting history.
Absolutely. It's been a pleasure. Thanks very much, Jennifer.
Thank you. Take care. Bye.
Bye now.